Good morning. As most of you know, I'm Amina Weiskerger, Executive Director of ShareBaby. I'm very excited to be hosting this morning's talk addressing vaccine hesitancy among the ShareBaby community. I'm thrilled to be leading this important dialogue today, where we will answer your specific questions and demystify information about the COVID-19 vaccine. A few housekeeping notes before we begin. We are offering live closed captioning. You can click the CC button on your screen to enable that. Also, the Q&A feature is turned off, but if you do have additional questions or questions that come up during the discussion, you can email them to lsaba@sharebaby.org, and we will get to as many of them as we can today. And if we don't get to your question today, we will respond to you within the next 48 hours. And finally, this session is being recorded. So if some of your colleagues could not attend, we will send a recording of this call to you so you can share the information. And with that, I'd like to thank you again for registering and joining us today, and introduce you to our moderator for this morning's discussion, who most of you know very well, Elsaba Osor, who is our program director. And Elsaba oversees all of our operations at ShareBaby, manages our partner agencies, strategizes changes and improvements regarding program structure, and helps to ensure that we are recognizing and addressing the needs of the communities that you serve. Elsaba has been a social worker working with families and children in a variety of settings in Baltimore City since 2012. And it's great to see you this morning, Elsaba, and thank you for moderating this morning.
Thanks so much, Amina. I'm excited to be here this morning with Dr. Michael Udwin, Practice and Payment Transformation Group Medical Director at CareFirst Blue Cross Blue Shield. With over 20 years experience leveraging advanced analytics and evolving electronic health record environments, he ensures broad-based physician engagement and alignment as risk-bearing organizations successfully transform care throughout the healthcare continuum. Prior to joining CareFirst, Michael effectively led population health-based strategic consulting for payers, providers, and government entities at Truven Health Analytics, Accenture, and most recently, Evolent Health. Dr. Udwin is a board-certified fellow at the American College of Obstetrics and Gynecology. Thank you so much for joining us today, Dr. Udwin.
Thank you. It's a pleasure being here.
Yes. So today we're going to take a deep dive into the questions that you also graciously pre-submitted. Thank you for doing that, surrounding the COVID-19 vaccine. And we hope to give you some peace of mind about the vaccine and learn how to best address the questions you're receiving from your community members. So we're just going to jump right in. So the first question, Dr. Udwin, is, community members are concerned about the safety of the vaccine that may not have gone through enough trials. Is this a safe vaccine, even though it has not passed all of the typical time trials of other vaccines?
Oh, well, Saba, it's such an excellent question. And I get the hesitancy. I get the question, especially in some areas and communities of color. There's good reason to question some of the information that comes out, and especially around vaccines in general and medical care. The good news is on this vaccine, it has been well tested. In the trials themselves, 30 to 40,000 folks were involved in each of the trials for each of the vaccines. Millions of people have received the vaccine with very few complications, and those side effects that occur, most of them are very small in nature. They go away after a week or so. Those are a little more worrisome, very small percentage, 0.2 to 0.4%. So totally get it. It's wise to question. It's wise to be your own advocate for your healthcare. But there's excellent reason to go ahead and feel comfortable in taking the vaccine. Great question, though.
Yeah, and then on that same vein, if, as a vaccinated person, how long does it take for the vaccine to be effective? And there's been some news around booster shots. Is that something that vaccinated people should expect? What's sort of going on with the booster process?
No, both are great questions, and certainly within several weeks, you're golden. You're going to be fine. So that immunity kicks in very quickly. It's important if you're getting a series of 2 shots for the vaccine to make sure that you follow the advice it's given to you, that you really are not fully protected for several weeks after the 2nd dose. So you really want to make sure you pursue both doses of the vaccine. Once you've got it, you're covered. I think there's still research going on to know how long it's giving you protection for. Preliminarily, folks think a good 6 months, probably a year out is realistic to think that it gives you protection, but it's not clear at this point. I think most of the researchers in CDC suggest that there'll probably be a need for a booster as we look into 2022. Unsure if it'll be a year afterward, or if this will be just like you go for your flu shot, you'll go for a booster for COVID. That might be the case, but I think it's unclear yet. And I think the good news, if you view it as good news, is they've been very transparent in conceding that they may not know all the answers yet. But I think it's reasonable to think 6 months to a year is at least reasonable.
Okay. And then this is a big topic so this question is about mask wearing. And so we know lots of mandates have been lifted. Some people are saying you can take the masks off. Other people are saying you shouldn't. So why is it important that folks who are vaccinated are still wearing their masks?
It's a great question.
Is it important?
No, that's such a good question. It's a great question. So first, the good news, right? The good news is if you're just outside, you're just loving life, you're not working, you're fine. Just follow the normal guidelines for your own community. If you're inside federal space or regulated space that requires masks, of course, you have to adhere to the guidelines. But otherwise, you should feel comfortable in responding or reacting to whatever the normal guidelines are for your area, especially if you're outdoors. It's a unique situation for folks in the healthcare field. If we're indoors, there's special considerations, right? We're around folks who may be immunocompromised, who may be in a position where they are vulnerable to infection, or even suffering from infections at times. So as much as it is to protect yourself, it's to protect those around you are the guidelines for why, particularly in healthcare settings or folks who are exposed to folks who are more vulnerable, it's important to stay masked. That's a really good question.
Yeah. And then if I'm vaccinated, am I able to still carry COVID-19 and infect other people?
It's a great question. I think there is no quote official answer. We know there's a very, very, very small percentage likely that yes, nothing is absolutely no, but it's so small that it's really not something that should be of a concern for the day-to-day person, that you really aren't likely to get infected. If you get infected, it's very likely to be a very, very mild case of infection. And generally speaking, the good news is you really are safe. And so that it's not something you should have to worry about day to day.
Yeah, that's reassuring. And I know there's, all of this information is still up in the air. And so it's important to sort of, figure it out as we go.
No, and these are the questions to ask. You're right to be considering it.
Yeah. And so now I want to pivot to sort of talking about the impact of the vaccine on our younger population. Our work at ShareBaby is with young children. Many of our partner agencies are also mainly serving young children. And so we know that it took longer to test the vaccine on children, but there's really not a lot of information out there. So any information you can sort of give us around these questions would be wonderful. Do you know, or is there any information about trials yet for younger children, like ages 3 to 5, that sort of age range?
Yeah, it's a great question. So, of course, the vaccine right now, it's authorized for use for emergency authorization from 12 and up. So right now, they're doing studies. The good news is studies are already underway for folks under 12 years of age, for 11 to 2. That information will be out by September, October. So we should have some information, maybe even some guidance on the availability of the vaccine. For under 2, even that'll be out by October, November. So there is research going on from 6 months on that we should know by probably October, November. Things may slip a little bit, certainly by year's end. So good news is there will be vaccinations available most likely for those under 12 down to 2, and even under 2 from 6 months on, probably hopefully by year's end.
Oh, that's really exciting. I didn't know that. So that's that's something to look forward to.
Right. I agree.
Yeah. And then if a mother is breastfeeding a baby and she's been vaccinated, is the baby then protected from COVID? Does it work like that?
No, it's a great question. So the answer is probably. The good news is in folks who have received and moms who have received the vaccine, they have identified the antibodies to the virus in the breast milk. So the good news is it does show up and likely is therefore conveyed to the baby. So how much is conveyed? Still unclear, but there is good evidence to show the antibodies have in fact been detected, which is a way of secondarily reassuring the mom and thereby the baby that there is some protection that's conveyed.
Oh, that's great. And then the last question that we have here, and again, I'm going to check my email right after I ask this question. So if anyone here has additional questions or things have come up, please send them to me and we can get them answered today because we are ahead of schedule a little bit. So this one is about the workplace and the vaccine. And so what advice would you give for folks who are trying to encourage staff members to get the COVID vaccine? I think generally, and also to staff members who have already had COVID and recovered, do folks who've already had COVID need to be vaccinated? And sort of how would you advise our partners to talk to folks about that?
It's a really good question, especially there's two parts to it. One on the COVID, if you've had COVID before, it'd be reasonable to ask, well, do I even have to worry about it anymore? There's a good reason to go ahead and still get vaccinated. One, there are variants, right, that we don't know. You may have had a variant that isn't necessarily going to respond as well. And we know the vaccine itself is very good at protecting you, even from the variants that are out there right now. The other issue that's still unclear is how long the protection you get from having an infection from COVID lasts compared to the protection you get from getting the vaccine. We think that's probably about 3 months, 90 days for those who've gotten COVID from an infection. As we talked about earlier, it's probably closer to 6 months to a year from the vaccination, from getting a vaccine to having that protection. So beyond the fact of the variants, there may be, and it's not clear yet, an added protection that lasts longer from getting the vaccine. So the simple answer is yes. If I'd had that COVID, I would have said, well, do I need to bother? It's worthwhile to go ahead and get the vaccine because of the variants and also because of the greater protection for a longer period of time you'll have by getting the vaccine.
Okay, that's really helpful. And then do you have just any additional information or advice? Maybe you've been in situations where you're talking to folks who are hesitant about the vaccine. Any additional information that you would want to share with this group, sort of about just, debunking vaccination myths and getting correct information out to community members?
Elsa, that's such a good question. And I think the way I would view it is to understand what's driving that hesitancy. There's often really good reasons why folks may be hesitant, and it feeds back into how we began this conversation. So just understanding what's behind their fear. Is it news? Is it family experiences? I think necessarily beating someone over the head with more data isn't necessarily the answer. It's really addressing the underlying causes, the underlying skepticism is going to be the best way, and modeling behavior. I think those who see that their colleagues who they respect have been vaccinated, that's contagious in a good way in this sense, and they'll go ahead and get vaccinated too. But I think just being a good listener, like we all do all the time, that's our best offense in terms of promoting the vaccination.
Yeah, that's really helpful, and I think really impactful. And thank you so much for sort of sharing with us. We're still definitely in a learning phase. There's so much information coming out. Like sometimes it's hard to digest it all. So it's helpful to have these sort of, it's like be in person, well, not in person, but face to face with someone who can sort of break it down instead of trying to digest all the information ourselves. So that I just checked my email. I don't have any questions, but as Amina said, please send them to me if things come up for you. And we are in touch with the Care First team and Dr. Udwin, and so we can get them answered for you, as soon as possible. And that was short and sweet, but super impactful. Thank you so much. I really appreciate it.
Thank you for including me. Thank you.
Yes.
Thank you, Al-Seba, and thank you, Dr. Udwin. That was super helpful. And I think, the overall message is, while we don't have all the information, it's just important to reassure folks of the safety and efficacy of the vaccines that we have, and how important it is to support people in making our communities as safe as possible moving forward. And I encourage all of our partners that are listening to reach out to El-Seba or I if you are having further challenges, and we will be able to work with Care First to get you some answers, moving forward through this time. So I want to thank everybody who attended today, our panelists. Thank you, obviously, to El-Seba and Dr. Udwin, and thank each of you that registered for this event. We hope that you found this insightful and helpful. And as I just mentioned, don't hesitate to reach out to us moving forward. Thank you so much.
Thank you.
Have a wonderful day, everybody. Bye-bye.